Hello, welcome to Expert Speak on Suicidal Treatment. I'm Jeremy Beachy. This is Psychology 496 with Dr. Harper. It's 14 September 2015. Many people have known somebody who's committed suicide or talked about committing suicide, or maybe they've heard from other people about someone who has committed suicide or talked about committing suicide. Suicide is the second leading cause of death in the United States among 10 to 24-year-olds. In 2012, 5,187 people in that age group committed suicide. The most common method of suicides were guns, suffocation to include hanging, and poisoning to include medication overdose. Over a 14-year period in the U.S., around 1,404 college students committed suicide. So we talked to a couple of experts, and we wanted to ask these experts a couple of questions. Basically, we wanted to know what the best treatment for somebody with suicidal thoughts or tendencies was. Our first expert, Dr. Lisa Betty, who has a PhD and is licensed in clinical psychology. She specializes in cognitive behavioral therapy. And our second expert, Dr. Terry Beers, who has a medical degree and specializes in psychiatry. Dr. Betty told us that she believes the best treatment for suicidal thoughts and tendencies was a three-phase cognitive behavioral therapy. The first phase was deactivation, and in this phase, the patient discusses recent episodes of suicidal thoughts and behaviors. Also in this phase, a foundation for treatment is built, and there is an understanding of how to deactivate suicidal thought, which is obtained through psychotherapy. Phase 2, modification. The patient is assisted in modifying skills that are closely associated with the risk of triggering suicidal behavior. And in Phase 3, construction, the patient is taught relapse prevention techniques. Dr. Betty told us that patients with a severe psychological tendency to commit suicide would be recommended for hospitalization before they went through the three-phase cognitive behavioral therapy. We asked Dr. Betty what she thought about drug therapy, and she told us that while she believes that drug therapy can help somebody that's suffering from suicidal thoughts or tendencies, that there's not enough evidence out there to show the efficacy of drug treatment. So we talked to Dr. Beers, and Dr. Beers believes that, in fact, drug therapy is the best solution for somebody suffering from suicidal thoughts and tendencies. And his plan is a three-step plan, with step 1 being the initial evaluation. And in this step, evaluating the patient is an essential element of the suicidal assessment process. During this process, information is gained about the patient's psychiatric and medical history, as well as current medical state and mental state of mind. Step 2, prescribing a medication and the dosage amount, which is based on the patient's history and the severity of the suicidal tendencies. And then step 3 is the psychiatrist would bring the patient back in to reevaluate how they are reacting to the medication after a period of time. Dr. Beers also agrees that somebody with a severe case of suicidal thoughts or suicidal tendencies should be hospitalized before any other treatment is attempted. Dr. Beers believes that psychotherapy is an effective treatment treating suicidal thoughts and tendencies, but he believes that because it takes time, daily or weekly visits, and the patient's required to continue to come back before eventually results are achieved, he believes that patients respond better to medication because it's easier to take, but a combination of the two would be most effective. Both of our experts agree that cognitive therapy can be helpful for those with suicidal tendencies. Both of our experts agree that drug therapy can be helpful for those with suicidal tendencies. But Dr. Betty feels that the most effective course of treatment in preventing future suicide attempts is cognitive behavioral therapy. Dr. Beers feels that the most effective course of treatment in preventing future suicidal attempts is medication. Our experts recommended a couple of websites. Dr. Betty recommended cognitive behavior therapy for suicide prevention, and you can see the link on the screen. Dr. Beers recommended medication and suicide prevention insights from neurobiology of suicidal behavior, and again, you can see the link on the page. Thank you very much.